All right, we have an update for you on the coronavirus crisis across the United States. As of things we're standing right now, we have 53,934 cases here in the United States, 728 deaths. This is according to the New York Times database. Of those, as it continues, the epicenter of the outbreak remains in New York State. 26,000 of the 53,000 cases residing in the state there. The White House advising everybody yesterday, anybody who has left New York City in recent days, asking that they self-quarantine for 14 days, just to give an idea of what the outbreak looks like in that city. And the NYPD revealing that 1 in 200 officers actually has coronavirus. So that is where things stand. That's where the numbers stand right now. Globally, we're looking at 431,100 cases. So still, it's taken quite a few lives across the world, almost 18, 19,000. All 728 here. And actually yesterday we lost our first, I believe the first child in the United States succumbed to coronavirus. And so right now the race really is on in order to get ventilators to the state of New York. Governor Cuomo, they're begging anybody who can get a ventilator.
Converting the Javits Center into a hospital.
Converting the Javits Center there. So that is where things stand right now. And he's warning states, if you don't take controls, New York is where you will be in 2 weeks, maybe 3.
Well, and if we're looking for that curve to be flattened, we are not seeing it yet, because every day when we're reporting out these numbers, they just continue to spike and spike and spike. So look, it takes time. Right? Once these lockdown measures are put in place, it takes time for them to work. It takes time for the virus to run its course. We are still right now at the beginning of this thing. And at the same time, news of another very prominent individual who has coronavirus. Prince Charles has tested positive for coronavirus. In a statement that his office put out, they say that he's tested positive. He's been displaying mild symptoms, otherwise remains in good health, been working from home. The Duchess of Cornwall also tested, but tested negative. They are both self-isolating at home in Scotland, and they don't know, with the number of public engagements that he's done over the previous weeks, they have no idea where he contracted this from. But yet another very prominent person who has come down to this.
The palace has said that the Queen is not as of now, has not been. She's in self-quarantine, listening to her advisors. Of course, they're both, I think Prince Charles in his 70s and the Queen is in her 90s. So, of course, hoping that everything is going as well with them for the foreseeable future. And then at the same time, India right now, the Prime Minister Modi locking the country down for a period of 21 days, basically banning all visitors going Fortress India. And we're seeing pictures coming out of India and for social distancing, in which at squares and in markets, they're basically creating 6 feet apart spaces for people to wait in queues, doing everything
like chalk on the sidewalk with circles of you can stand here, and then 6 feet back you can stand here.
It's kind of amazing. It's going to be very, very difficult. So having read, before this all started, I started reading some histories of the Spanish flu. And from that, India and Africa were actually terribly hit by Spanish flu, didn't have the public health infrastructure back in 1918. Of course, things are a little bit better this time around. But look, this is a country of 1.3 billion. I have much of my family, elderly family, that lives in India right now. And people are worried. You can't get so much of, especially elderly people, rely very much on people coming and helping, so they don't have caretakers, workers, and cooks and things like that in order to help out. Also, free movement across the subcontinent is just something that is a fact of life there.
Right.
You've been to India. When you don't just stop seeing people. There's nowhere in India that you stop seeing people. You could be in the most rural part.
Social distancing is not really a possibility there.
It's a big country, but there's a lot of people that live there. And so this has kind of been the nightmare scenario for coronavirus. It wasn't necessarily China, which has they have a very good, they at least have an ability to lock down sections of its population.
Right.
It's Pakistan, it's India, it's Nigeria, highly populated countries with not necessarily the most robust state infrastructure, and they are going to be put to the test. In the coming weeks.
Or the most robust public health infrastructure. You are talking about 1/5 of the population there. Today is day one of the lockdown. They've had basically 4 hours notice before it was everybody must stay home for 21 days. And as you said, both of us have relatives there on my husband's side. We've both spent significant time there. And, especially in the large cities, the population density is just, like nothing that you really see anywhere in the U.S. It's kind of hard to wrap your head around. There's just, there's a lot of people. That's the bottom line, which makes it so much harder to contain this virus. So far, they've only had something like 600 cases that have tested positive, so it's a relatively small number. Hopefully, they're getting on this in an aggressive manner, which frankly we did not do, which is part of why we are seeing things spiral so much here, particularly in certain hotspots around the country. Hopefully they have taken fast, aggressive measures that will blunt the worst of the impact of this for them.
Hoping for the best there, of course.
Absolutely, and we'll be keeping track on that and all other things. Thank you for watching. We'll have more for you later.